I, I think we're ready to get started.
Perfect. We'll go ahead and get started. Good afternoon, everyone, and welcome to today's webinar. My name is Chelsea Townsend. I'm the director of the South Carolina Prescription Monitoring Program, and I chair the NASCSA Education Committee. I'll be hosting this afternoon's webinar along with NASCSA's Kathy Keogh. So hopefully you guys read through the scrolling materials while waiting for the webinar to start, which provides information regarding our sponsors, a NASCSA disclaimer, housekeeping items, and announcements. A couple of reminders, we've said this on the past couple of webinars, but NASCSA has officially launched their social media. So please be sure to follow them on Facebook, Instagram, LinkedIn, and X. The final 2025 conference schedule is on the website now. If you haven't already registered for this year's annual conference, please make sure you go ahead and register now. It's going to be a great conference. The agenda looks amazing. And then for those of you attending the conference, Kathy sent out through the newsletter that they are going to be doing a New Orleans tradition, which is a second line parade. So please feel free to go online on Amazon and purchase something to wear for the parade. Today's webinar and all of our webinars throughout the year would not be possible without the generous support of our sponsors. So thank you to our sponsors, and thank you guys for taking your time out of the day to join us for today's webinar on responding to emerging public health priorities related to controlled substances. We're really excited to have Susan Winckler with us today, so please allow me to introduce her. Susan Winckler is the CEO of the Reagan-Udall Foundation for the Food and Drug Administration. The foundation is the nonprofit organization created by Congress to advance the mission of the FDA. Previously, she was president of Leave It Partner Solution, advising healthcare and life sciences leaders on policy, strategy, and risk management. She also led the DC office and served as interim executive director of the Healthcare and Transformation Task Force. A pharmacist and attorney, Ms. Winckler was the CEO of the Food and Drug Law Institute and served on its board. At the FDA from 2007 to 2009, she was chief of staff, senior advisor to commissioners, and led multiple offices, including FDA's medical product negotiation with China. Earlier, she held various roles at the American Pharmacists Association. She holds a pharmacy degree from the University of Iowa and a magna cum laude law degree from Georgetown. Ms. Winckler is an APHA fellow and serves on multiple advisory boards. So welcome, Susan. The floor is yours.
Fabulous. Thanks so much, Chelsea. I appreciate the invitation to be here today and to chat with you about some of the work of the foundation. So let me begin, and again, really appreciate the invitation to talk with you today. So I am going to talk about some of the work of the foundation that relates to controlled substances, and because of our intersection with the FDA FDA's lens on this are that these are emerging public health priorities. So as Chelsea mentioned, I am with the Reagan-Udall Foundation for the FDA, and we were created by Congress to help the FDA do more to protect and promote the public's health. And so we do a number of projects both for the FDA and for the broader food and drug ecosystem to help support what it is that the agency is aspiring to do. So one of the ways that we try to describe that is that we help connect the agency to the outside world. So we bring them stakeholder input on various topics. We often are looking at the emerging and under-addressed areas, so things that are a new challenge for the agency. And then we do some research to help them better understand different areas. So in the areas related to controlled substances, I'll acknowledge I had reached out to your organization because we were doing some work that we that definitely crossed in the spaces where you all are working every day, and was so intrigued by the work that you do. And then Kathy extended this generous invitation for me to be able to share with you some of the work that we've done, and I hope lay the groundwork that as we continue to work with the agency, that we might have the opportunity to work with each of your organizations as well. So today I'm going to talk about 3 or 4 different projects we've done that fit in these areas. So we have done work with FDA as it relates to informing healthcare professionals and consumers about controlled substance topics. And the example I'm going to give there is to walk through some of the things we've done about purchasing controlled substances online. The second area where we do a lot of work is in supporting development of regulatory frameworks to things that are emerging. And there we'll talk about emerging uses of ketamine, which is a quite an interesting area for engagement and understanding that quickly changing landscape. And then the third is in the agency's work to promote appropriate access to substance use disorder treatments and risk reduction tools. So I'll touch on a couple of projects that we have done in that space. So this is just one of the ways that we do our work for the agency and for the broader stakeholder community. We always have, if we do a meeting, we always post the full meeting, the transcript, the slide deck, and then we generate a report. So this is just a snapshot of some of the reports that we have done. In addition, if we do invitation-only conversations, because as we know, there are some conversations that are more productive when they're held in a smaller environment. We produce a public report about that work to make sure that there is a broader reach for it. And all of these materials are housed on our website, which is Reagan-Udall.org. So let me talk about the first topic, and this is one where we just had a meeting earlier this month to explore this. As you all know, there is a significant level of activity where criminals are misusing digital resources to illegally sell controlled substances. And so we have been working with FDA for a couple of years to learn to support their efforts to inform healthcare professionals and consumers about safe purchasing behaviors. And that requires learning more about that environment where these products are being sold. It requires talking to a lot of the digital players themselves about what they might do, and just generally thinking about where might regulators, particularly FDA, engage to respond to this dangerous environment. So let me talk about some of the work that we've done in this space. One of the things that we often do for the agency is help to explain things a little more clearly than might otherwise be done. And so we first said, let's map out the legitimate supply chain for prescription medications, including controlled substances, which to many of you, particularly those who were trained as pharmacists, you're like, well, this is obvious. And this everyone would know this. In fact, that's not the case, and have found that this just understanding the regulatory, and then how things work to have a prescription issued and then make it available to the patient is helpful just as consumers try to understand the marketplace, and in particular develop the mindset that while online can be a great way to find a number of different products, it is not the very best way to find controlled substances. And we'll talk a little bit about the research that we've done in that space. So one of the things that we've done is just to evaluate social media and online communication platforms and how they are misused to sell controlled substances. And the way I like to think about this is that the street corner of the past is now the internet of today, and particularly getting into some of the dark web spaces, but also just generally misusing communication tools and apps that we might all have. Those can be misused to facilitate illegal access to controlled substances. If we think about it, it's a fairly open market in that nearly anyone has access to it. And there are many features of the digital environment that are quite user-friendly if you are aspiring to engage in criminal activity. Disappearing posts, ease of creating new accounts, being able to encrypt certain data, all are simply an environment where you can breed and facilitate the criminal activity, as well as the availability of a number of different platforms allows the criminal network aspiring to bring controlled substances, often not legitimate controlled substances, but bring those controlled substances to consumers outside of the healthcare system. The number of different platforms that allows kind of quick movement, and basically it's an environment where you can fairly easily support that activity that we would want to shut down, which then creates its own challenges for regulators in addressing that environment, creates challenges for the digital resources themselves, because they don't want to see the misuse of their platforms for that environment, and just generally creates quite a, it results in an environment that has real risks to individuals. So part of the work that we did at the foundation was to talk to consumers to better understand why they might seek out controlled substances in the digital environment. And this was done both through listening sessions and polls, and pursuing the research questions to better understand who is purchasing controlled substances online and what motivates people to purchase them online or via social media, and kind of what does that process look like. So aspiring to look at it from the consumer perspective. And so what we have learned is that despite the policies and the laws that prohibit that illegal sale, and I should say I'm not talking about here legitimate prescriptions that go to legitimate pharmacies that might have a digital presence. This is the illegal sale of controlled substances by those who do not hold a pharmacy license, are not legitimate sellers. It's the criminal sellers. And so although it's illegal, there is a lot of activity that gets around that legal structure, whether it's creative search terms, some indirect links, going inter-party platform. There are ways to facilitate the transaction. What was also very interesting in our research is that common motivations for purchasing through digital tools are the fast discrete access. And as we'll see, it may also be inspired by the scarcity of resources to get a prescription, as well as resources when there are drug shortages. So there is a tension here in assuring sufficient availability through legitimate channels can cut down some of the appetite for accessing through illegitimate or illegal channels by folks who actually may not know that they are seeking products through something that's illegal, because frankly, if I asked any of you if there was something that you were out of at the local store, it's often instinct to then look online to see where you can find it. That same thing happens with prescription medications, including controlled substances. And then also there are, just as I mentioned, it's quite the information ecosystem and way to have communication with a lot of people and be able to navigate that communication, that it can evade safeguards. So in our research, we said, why is it that consumers would purchase controlled substances online? Cost, convenience, and access. I think one of those is directly related to aspiring to get it outside of the legal system. Others are not. At least some of the consumers who are accessing controlled substances online from sellers who are not within the legal prescription drug chain or controlled substances chain do not realize that they are buying them outside of that system. They're seeking a different source of their medications for cost and convenience. So in a way, we're seeing the dynamic where folks are being drawn into this environment where then they're being put at risk. So we had some specific polling here about why might someone purchase a controlled substance online, and this just grids out for you the percentage of all respondents, and then by age of whether it's under 40 or over 40. And for those who are under 40, which is this middle column here, at least some portion here in the middle are going the online route because of the cost pressure, so not being able to afford it through a regular pharmacy, or not being able to find the medication. So again, it's this intersection with the shortage dynamic, as well as you can see, some reasons given as a way that it may be a fast way to obtain the medication. This is just a piece for interest here. I'm fascinated by what we learn about the ecosystem. One of the ways that regulators are responding to the online sale is trying to keep pace with how it is that the network is advertising, and that's often through emojis. And so these are common emoji codes that are used to try and access control, well, really for those who are selling controlled substances to advertise or have a communication about what it is that they are, what they have available for sale. What we pulled from all of that work, and in all of these, I'm going to be giving you a snapshot of months and sometimes years of work in just a few minutes so that we can cover at least 3 projects in the hour of the webinar. But here, what we came out with, some of the themes is that there were a couple of different areas where regulators and public health players could intervene and try to help make that digital ecosystem safer, so that we're directing people to legitimate pharmacies, licensed pharmacies, versus them being drawn into the criminal enterprise. And that's acknowledging first that some of these are motivated by it. There's different motivations for wanting to access controlled substances online, but some of it is with a legitimate prescription and it's simply not available. So here, some of the opportunities for public health intervention are to think through that what it is that those consumers might benefit from hearing, and describing what the legitimate system is and solutions for the challenges they might be finding in finding product. Another is that we should just acknowledge that for many of the folks, when we have messaging in this space, we're not really reaching the intended audiences or having the intended impact. And so there's been a lot of work here to equip trusted messengers with the right messages about safer behavior. Another key area where there's opportunity to do better or do more is in partnerships. And this has been a really fascinating set of work where we've had the opportunity to work with folks across the digital ecosystem. So thinking about those who are supporting search, which is one of the first places where you might have someone, looking for a product, to the social media where there might be the connection and the messaging to have it, all the way to the marketplaces where some of these transactions might take place, to the payment structure. And that by bringing all of those platforms and organizations together and providing them the ability to chat, then they can learn about, for example, the newest language that's being used to describe a certain substance, or the latest emoji. They can share information about bad actors so that they can simultaneously, if an actor is removed from one platform, the next platform that they try to go to knows about them and can be able to protect against that. And then finally, there's a need to address the compliance issue, and that sometimes ways to push back on that and to assure that there's communication about the unapproved or counterfeit drugs, and continuing to pursue the purveyors of those outside of the digital environment, so that we can continue to shrink the source of the illicit product. So a shorter piece in there of what can we do. There's certainly an opportunity for public education to be thinking more about what are effective messages and providing those messages at the right time, as well as thinking about the supply chain and making sure there's enough medical supply to meet the patient need, and reducing some of the friction points for patients so that we can keep them in the legitimate market. So one of the tangential projects to this also came to us with a focus on prescription stimulants. As many of you have seen, and you probably know more than most audiences, that there has been an increase in the prescribing and use of stimulant products, and those same products, particularly those used for ADHD, have been on the shortage list since 2022. And there's been a lot of, this has been, and pardon me, I'm going to mute for just a second while I cough. Hang on just a second. Excuse me. That where there has been an increase in the use of telehealth in the diagnosis and prescribing of stimulants for ADHD, we've also then seen the increase in aspiring to access stimulants online. And so that's just a piece we've helped the agency understand some of that environment. So so as we were doing that, we got a lot of questions with people aspiring to understand what drives that. And these are some of the things that have come up as factors that affect prescription stimulant availability. And as you can see, again, you probably know a number of these things, but there are so many things that can affect the availability of whether there's a product on the shelf, that it's keeping in mind all of these things, that we address all of them and make the product available. And I am aspiring here. If you can tell, this is one of those situations where when you're working in an office without very many people, I'm concerned that I don't have enough water to get me through this presentation. But we will get there. That's the work that we've done. I'm happy to talk about more of that. It's been such an interesting space to understand and challenge our preconceived assumptions that, certainly I know there were a number of us who going into the project thought, well, the only people who are looking for controlled substances in a digital environment are the same people who would be looking for those substances because they know they can't get them from legitimate sources, and that simply is not the situation. We have a reality where the digital marketplace is attracting and diverting other folks who can then are drawn into purchasing in an environment that they had no intent from which to purchase. This is where I have to thank very much so my colleague who just handed me a glass of water and will make this a much more interesting presentation now that I can make it through it. So happy to come back and answer questions about that project, but that's one where it's been just fascinating to think about how we might take regulators working with the digital ecosystem and healthcare professionals and others in that environment to provide a better structure for patients to access controlled substances legally and legitimately, and obviously far more safely, as well as to intervene and help those who are actively seeking the illicit product to have more awareness of the danger that they're engaging in, and also then trying to shut down the criminal enterprise on the other side. So it's that idea of building a collaborative network to help consumers and to shut down the criminal activity on the other side. So we'll wrap up with that first project. And with that, give me just a moment to see if I can take care of this tickle in my throat, and we'll continue in just a second. All right, if we were in a room, that's where you could have taken a stretch break. So I hope you just did that quickly. Let's return to our digital room. And now I want to talk about some of the projects we've done in our second topic area, which is to think about helping regulators respond to emerging trends and issues in the controlled substances landscape. And here I'm going to talk a bit about ketamine as well as psychedelics. And these are things that may be top of mind for some of you in your day job, but I think are also topics that we will continue to be tracking and working on today and tomorrow. So in this space, one of the realities is that there is an increasing use of ketamine clinically. So where you have new providers who are prescribing ketamine off-label, which, right, like let's confirm that is legal. Ketamine is available. It is an approved product, and it is within the practice of medicine for physicians and other prescribers to prescribe ketamine off-label, most often for the treatment of psychiatric disorders. And so what's showing here is the increasing number of ketamine providers. And then there is an understanding that some of this too is the illicit, there's also an accompanying increase in illicit use. So there has been an increasing number of ketamine seizures from 2017 to 2022. So we're certainly just seeing more ketamine in places where it shouldn't be, I guess is the best way to phrase that. And so FDA was interested in learning more about how ketamine was being used and to gather information, in particular whether that information should then be captured on the product label, so that healthcare professionals would have a better understanding of it, as well as to understand from a enforcement perspective where there are continued concerns, because you have this rise in clinical use and a rise in illicit use, and how should that availability be managed. And one of the ways that ketamine is then delivered for the treatment of psychiatric disorders, so in that legitimate, if off-label use, so clinical use, is that it's compounded. Now there are an increasing number of clinics and an increasing number of telehealth online offerings for ketamine. And so this was part of our work to try and better and understand and discern in the compounded ketamine products. And part of what FDA has done here is to try and explain what are the risks in compounding, which is somewhat separate from the risks in prescribing and use, and distinguishing that from the illicit use. So this is about trying to better understand the clinical use, as well as then the clinical presentation and compounding of ketamine, and how that compounding might be done in a way that meets patients' needs and is done safely. So I mentioned the telehealth component. This is just a bit of the business model for the telehealth. And Chelsea, I see you raised your hand. Do you want to go ahead?
Sorry, I don't know how I did that.
That's all right. I'll take it as a hello. So I had mentioned this is the telehealth business model specifically for ketamine, and so just an understanding so that we understand the various ways that the ketamine is being compounded and then reaching the patient as well as prescribed. And then this is to distinguish. We were aspiring to illustrate and learn more about where you have legitimate digital pharmacies providing ketamine versus those who are the online sellers who are selling it outside of that off-label use, but are really more in the illicit market. And so there are some distinct differences here that are important in aspiring to distinguish that, because where we're learning more about ketamine's clinical use and there's additional clinical evidence being generated that it may be helpful in a number of psychiatric situations, it's an attempt to assure that the efforts to shut down the rogue online sellers, that we can distinguish that from the legitimate prescribing and legitimate use. And so this chart shows those two different presentations. And I'm going to bet that most of you are not surprised by what you might see here, that there are differences in whether it's anything from differences in information about the business that's there, and to whether or not they comply with laws and regulations. An important note here, and it's seen in other places for online sales as well, is the financial source for the transactions, and that accepting credit cards is often a feature only of those that are within the legitimate supply chain, whereas the others only accept cash or other forms of payment. And of course, we would start with, is there a strong triad relationship between the prescriber, the pharmacy, and the patient? That's a key distinguishing factor of these two sources of ketamine. So then there's an interesting dimension that plays in for advertising for ketamine therapy, because many of you may know, and of course we have all learned more or been, for several of us, reminded about who has authority over the advertising of prescription drugs. But FDA's authority is over the direct to consumer and ads that are issued by or on behalf of manufacturers and distributors. And they have the prescription drug products within that component. But much of the advertising in the ketamine marketplace is not from prescription drug manufacturers or distributors. It's from the wellness clinics, the telehealth prescribers, or the med spas. And those are outside. FDA's authority is over the manufacturers, not these providers. So this is a space where there certainly is some questions for regulatory environment in thinking through how to address a dynamic like this one, where the advertising that is being done is not by the entity that's regulated by who we would think in the regulatory environment. And so then we also, as part of this broader and kind of looking at what is happening in the ketamine space, looking at what state and federal enforcement cases have been made. And there hasn't been a lot, as well as the opportunity to provide oversight for clinic, spas, and wellness centers. I will say a bright spot here is that there are work by the professional licensing organizations to better understand what should be done in this space, and that is work that we hope will be informed and advanced by the research that we've done in the ketamine space. So that was ketamine, and trying to better understand and distinguish between the off-label use of a legitimate product within the healthcare system, and then the expansion and explosion of really on the fringes of that, or where it may be an illicit. Similarly, another emerging case where we've been collaborating with the FDA is to help better understand and further the advancement of the clinical review and the clinical data that it's available related to the use of psychedelics. There are some, well, I could go down a deep hole of talking about clinical trial design and the things that are necessary there, but it's I think an understatement to say that it can be, there are some unique challenges in studying psychedelics and their impact. And so this was a project where we worked with FDA to have a discussion about those different dynamics and how that clinical research should be brought to the agency. And then also had a conversation in that same meeting about how were a psychedelic to be approved at the federal level, which is right, there's still opportunities for that to happen. What coordination might that require at the state and even at the facility level? Because there are some states where states have sanctioned the use of a product, but it's not yet federally available. Should it be federally approved, then helping consumers distinguish between that product that has been through the federal approval process and then obviously manufactured to good manufacturing practice standards, distinguish that for the consumer to be able to distinguish between those two, as well as if we think about things like an adverse event reporting system, how might we distinguish in the adverse event reporting system between the products that are made available via approval and are in the fully are in the FDA approved category. I guess there's not really thinking of a better way to phrase that, versus those that have been authorized by a state to be available through simply a different structure. That being able to distinguish between those two different types of products will be important in better understanding the true adverse events that are associated with the approved product. So that was kind of a future, we'll need to figure that out. So that finished our topic number 2 in thinking about emerging uses. I will say that's a part of the work that we do that I find just fascinating in better understanding what is happening in that landscape and evolution of the in the use of controlled substances, where we continue to understand and better deploy controlled substances for the benefits that we all know that they can provide. So now let me turn to our last topic that we wanted to just provide a snapshot, and that's thinking about how regulators can promote appropriate access to risk reduction tools as well as substance use disorder treatments. So here, thinking about the flip side, where we know there are certainly can be negative consequences to controlled substances, and how might regulators be on the flip side in helping patients or consumers with those tools. So we did quite a bit of work in the discussions about the naloxone opportunity to move from prescription to the over-the-counter environment. We're now obviously in the over-the-counter environment where naloxone can be accessed without a prescription. But when it was still in prescription status, there was, generating a consensus that emerged that increasing access to naloxone would be good for public health. That it's a product, obviously, I started this saying, I'm assuming you know that naloxone, what it's used for. So let me remind us all, right, that naloxone is one of the products that can reverse an opioid overdose. And so there was emerging evidence that having naloxone more available would be good for public health. It has a high safety margin with low potential for misuse and abuse. But FDA had to explore some questions related to that, about whether it can be used appropriately by consumers for self-diagnosed conditions. That's a way of phrasing whether it can be used without a prescription. And can it be adequately labeled to allow for safe and effective use? And so while that evaluation was going on, there was also a need to discuss and think about what are the opportunities and what has been done to increase access to naloxone when it was available only by prescription. And that's where we saw there was broad and continued broad statewide standing orders, or the authority of pharmacists to prescribe naloxone, to provide naloxone, prescribe it and dispense it with opioid prescriptions. And you had a significant amount of community distribution of naloxone as well. And so part of what the FDA had to evaluate in this is whether there were going to be any potential unintended consequences. And one that was often raised was that if naloxone were moved from prescription to over-the-counter status, that there would, and in many environments this can be true, that there's no longer health insurance coverage, which would then increase the out-of-pocket cost for naloxone. And so would that end up creating a barrier? What was interesting is that we did some work to evaluate where naloxone was being distributed. And this chart showing 2021, so this is when naloxone was still a prescription product. It was the unique prescription product in that a significant part of the distribution was not through a pharmacy, but rather was through community-based organizations, and other places. So that actually said then that where the insurance coverage might be a barrier was in this part that was a much smaller part than the universe of a typical prescription drug. I'm not sure that anything like this chart exists for other typical prescription drugs. And so that confirmed that the majority of naloxone at that time was not distributed through community pharmacies, but rather was being distributed through health departments, community-based organizations, and first responders. That's the type of information from the broader ecosystem that is helpful to regulators to understand the environment in which we're operating. So then another place where we have, it's helpful to get that ecosystem conversation has been about fentanyl test strips. So these are strips that are used for consumers and for clinicians to check for the presence of fentanyl in the non-medical drug supply. And what can happen here is that individuals use the product to better understand if they're at risk for a fentanyl exposure. And this was a really interesting way to dialogue about the clinical dynamic for that, as well as the community perspectives, and to just better understand how fentanyl test strips might be used to understand the risks in a non-medical drug supply, with the intent of keeping those individuals alive so that we might help them at some point, that they should not be poisoned by the product that they were taking. And then finally, a place where we have worked with the agency as regulators think about how do you increase access to different pieces is not only on the naloxone and the fentanyl test strip, but also then saying where buprenorphine is used as a treatment for opioid use disorder, what are the different barriers to accessing it, as well as what are some of the questions about how best to initiate and use buprenorphine in an environment where the opioids that are used in opioid use disorder are changing, and what might that change for the clinical implications as it relates to buprenorphine. So really interesting discussions there to understand what is helpful, as well as to understand this is a map of thinking through what are the treatment journey challenges that an individual might face in trying to access buprenorphine. And it can range everything from some of the health system barriers about whether there are even enough providers to prescribe buprenorphine, to whether it's paid for in a typical health insurance environment, as well as the patient perception and individual challenges. Then there's also just some challenges that as it related to regulatory and at the pharmacy level, some realities about the way the product is available. In one of our conversations, we heard from individuals who had long-term dental damage because of the way the way that the buprenorphine is administered and the holding of the tablets, that it would cause long-term oral health challenges, as well as just a difference in looking for the having the right types of buprenorphine formulations available. Having this understanding can then also help regulators and others think through how to help more appropriate access and use of buprenorphine for opioid use disorder. And so these were some of the the takeaways from the suite of work that we did in that space, with thinking about whether it's just the clinical practice regulations that could help expand appropriate access and use of buprenorphine, to thinking through the types of products that are available and how they should be used, as well as what can be helpful in a post emergency services environment. And then continuing to have the conversation about opioid use disorder as a chronic health condition that then may often requires chronic treatment, and how that is important for those individuals to treat the health condition. And with that, that brings us back to that array of all of the reports that we've written in this space, and I didn't even talk about all of them. But Chelsea, I'm happy to take any questions, or you and I can chat about pharmacy issues, whatever, whatever we should do now. But that's the end of the tour of the work we've done in this space.
Perfect. Thank you so much, Susan. That was wonderful. We do have a question in the chat. So one of them, or the question says, has the removal of the X waiver increased buprenorphine access?
Certainly is helping to have, to have, it has helped. There are still challenges in prescribers wanting to get into the buprenorphine space, as well as we know there are a number of pharmacies that don't dispense it. So we do still have some stigma challenges in aspiring, but the removal of the X waiver has helped.
Perfect. And then any stats on length of buprenorphine use? How long are folks staying on this medication?
So it is a chronic medication. And so I do not have the statistics right here in my head, but I will be happy to share those. One of the things that we looked at that just comes to mind more acutely was the need. Sometimes you have to start with a higher buprenorphine dose depending on what the opioid of abuse was. But yes, there is certainly, there are individuals who require long-term buprenorphine use to manage their chronic condition of substance use disorder, of opioid use disorder.
Yeah. And then what future work does the foundation have planned? And then how does the foundation interact with the FDA? Does the FDA direct the foundation as far as priorities or projects go?
So let me answer that part first.
Yeah.
As the foundation for the FDA, we do some projects that are directly funded by and directed by the agency. And so a fair amount of the work that I described fell into that category. Then we also do projects that the FDA is aware of, but might be funded by the private sector. And often those can be ideas that have come from the FDA, but there may not be funding to do it. And we're, part of why we exist, we have no other purpose, so we can go find that funding and deliver that project. And then a third type of projects where it's generated by folks outside the FDA, but we are a way to engage the FDA in those projects.
Okay.
Then what else are we doing in controlled substances? We are expecting to continue a lot of the work in better understanding different substance use disorders. So for example, we're doing some work now and trying to better understand the clinical needs and the environment as it relates to cannabis use disorder. Thinking about product development in alcohol use disorder. And certainly one of the projects I didn't talk about but has been ongoing is related to stimulant use disorder. And in all of those, one of the important things for FDA and product developers is aligning on what are the endpoints that are of interest, right? Like, what does success look like if you have a substance use disorder? And and that might like seem like like an easy question of like, well, I just want to be better, or not have that drive to use in a way that negatively impacts me. But translating that into into a clinical trial where you can measure something and then be able to deliver some sort of intervention that has a measurable effect that matters to individuals, it's much harder than you would think. And then also helping to think through a lot of substance use disorder co-presents. And so how might you help someone navigate if they have opioid use disorder and stimulant use disorder? Is the same treatment effective? So we are expecting to continue our work in that, as well as in the work related to the online access to controlled substances and helping the digital ecosystem, better respond and thwart that clinical network. Sorry for the long answer.
Chelsea, can
No,
I ask a quick question, sort of related? There's been a lot of concern from the states about gabapentin, and I'm just curious whether that was in your sort of suite of projects that you may be looking at or have looked at, even though it's not a quote controlled substance.
Yeah. So although today all I talked about was controlled substances, we actually do a whole lot of work on other things like produce safety and animal health and fluoride. So we do a lot of work not related to controlled substances. We have not yet done anything on gabapentin, but we might in the future. So I should say we aren't just the Reagan-Udall Foundation for the FDA, for the part of the FDA that works on controlled substances. That's just what I highlighted for you today.
Gotcha. Thank you.
perfect. How does the foundation solicit input from stakeholders, and then how can NASCSA members get involved in the foundation?
So a lot of our job is soliciting information. So we will do everything. Sometimes it's through official polling and mechanisms to do that. Sometimes it's through holding a meeting and saying, if anybody wants to come and provide public comment, we're here and ready to talk. We just did that for a meeting that we held to talk about the front end of controlled substances. So demand modeling, how is it that companies, and how should the DEA and FDA think about the modeling the demand so that the quota can be set for controlled substances. So we'll often put a call out, and we're looking for responses. I'm looking forward just to the connections that we've done here, because as we were even thinking about the ketamine piece, we thought, I wonder how the prescription drug monitoring programs track ketamine, and does that vary by state? And so I'm excited to have connected directly with Kathy and with you, Chelsea. And I will say, if folks have ideas, reach out. We are always happy to talk and think through and explore different things. So I guess I should say, you should plan to hear from me. My usual MO is, hey, I'm knocking on your inbox with this.
Perfect. We have a whole PMP committee within NASCSA that has most of the states as members. So anything you need help with on that front, we're happy to facilitate. I will say a lot of the PMPs also do annual reports. So I know South Carolina published theirs from 2024, and we did a special edition on ketamine to look at growth rate for ketamine dispensation. So that may be something that you can get kind of those de-identified trends from state level PMPs.
Absolutely. And then I have to say that one of our amazing team members at the foundation worked in DC with she has experience with PDMPs. So Joy Eckert brings us a kind of a firsthand of, oh yeah, we should reach out to them.
Yes, we are happy. Just out of curiosity, have you seen the recent study published on OTC naloxone that suggests that the OTC naloxone isn't closing the gaps in community availability? And then do you think the FDA will look at any other opportunities to expand naloxone distribution?
So I think FDA is very interested in saying, how do we get the product where it needs to be? And I'd say probably more than FDA thinking about that is SAMHSA, right? I'm thinking from the Substance Abuse and Mental Health Services Administration. How can we get it to the places where it should be? FDA's primary role was in may it be available non-prescription, so they're still interested in making sure that it gets expanded. But yeah, we tried to address the unintended consequences, and then we probably should have predicted that one change was also not going to yield getting it exactly where we needed it to go. Although it is in the glove compartment of my car because I have teenagers, and it actually is my gift to most moms of teenagers of just have this, have it available, and send it with your college student.
Yeah, that's very important.
Amen.
Perfect. Well, thank you so much, Susan, for doing this webinar for us today. I know South Carolina looks forward to partnering with you as well as probably a lot of other PMPs and the diverse membership that NASCSA offers. So on behalf of the National Association of State Controlled Substances Authorities, I would like to thank everyone who joined us for today's webinar. Again, a special thank you to Susan. Thank you to our sponsors for making today's webinar possible. And then we wish you guys a wonderful rest of your day.
Thank you.
Take care.